මම කැමති මේ රස ඖෂධ පිළිබඳව දැනගන්න. ඒවා අපට ඉගෙන ගන්න පුළුවන් තැනක් තියනවාද?
Is there any proper place to learn a lot about Rasaushadhi? Is that, madam?
Yeah, that's right.
So, Professor Sayakara?
හොඳම ප්‍රශ්නයක් මම හිතන්නේ ඒක මොකද මේ බොහෝ ශ්‍රී ලංකාවේ ඉන්න ආයුර්වේද වෛද්‍යවරුන්ට විශ්වවිද්‍යාල මට්ටමින් උගන්වන රස ඖෂධ සම්බන්ධයෙන් හැර එය වැඩි දියුණු කර ගැනීමට අවශ්‍ය ප්‍රතිපාදන තාමත් we don't have any ප්‍රතිපාදන අපිට එහෙම නැහැ. ඒක නිසා මම යෝජනාවක් හැටියට එතුමියට අනිත් අයට කියන්න කැමතියි. අපි දූතපපේශ්වර කම්පැනියට යෝජනාවක් ගෙනෙමු. එක්කෝ විශ්වවිද්‍යාල මට්ටමින් සර්ටිෆිකේට් කෝස් එකක් හරි ඩිප්ලෝමා කෝස් එකක් හරි එහෙම නැත්නම් අපේ ෆැකල්ටි එකෙන් කරන්න පුළුවන්. එහෙම නැත්නම් කැලණි විශ්වවිද්‍යාලයේ ඒ දෙකෙන්ම ආරම්භ කරන්න පුළුවන් කෝස් එකක් හැටියට නොමිලේ නෙවෙයි යම් කිසි ගාණක් ගෙවලා එහෙම කරගන්න හැකියාවක් ආරම්භ කරොත් I think that it is much better.
Yes, madam, I think you having also an answer and she'll elaborate in Sinhala.
Yeah, it's better to answer in
yes,
Sinhala,
madam, yes, please.
right? So, Doctor, මම ගම්පහ වික්‍රමාරච්චි විශ්වවිද්‍යාලයේ දේශීය වෛද්‍ය විද්‍යාපීඨයේ විශේෂයෙන්ම රස ද්‍රව්‍ය ගුණ විඥාන රස බයිසජ්‍ය විෂයන්ට අදාළ අධ්‍යනාංශය නියෝජනය කරන්නේ. ඉතින් සාමාන්‍යයෙන් අපි සෞඛ්‍ය ශාස්ත්‍රයේ ඉන්න ආයුර්වේද වෛද්‍යවරුන්ට අපේ විශ්වවිද්‍යාලයේ ද්‍රව්‍ය ගුණ අධ්‍යනාංශය මගින් දැනුවත් කිරීමේ වැඩසටහන් සිදු කරනවා. විශේෂයෙන්ම රසශාස්ත්‍ර රස ඖෂධ පිළිබඳව අපි පහුගිය වකවාණු වලත් ඒ පිළිබඳව කළා. ඉතින් විශේෂයෙන් සමහර පළාත් මට්ටමින් නැත්නම් ප්‍රාදේශීය සභා මට්ටමින් මේ විවිධාකාරයෙන් ඔවුන් අපේ ඉල්ලීමක් සිදු කළාම අපි මේ දේවල් කරනවා. ඉතින් ඔබතුමියලටත් පුළුවන් එහෙම විශේෂ ඉල්ලීමක් සිදු කළොත් අපිට රස ඖෂධ පිළිබඳ මූලික කාරණාවල රස ඖෂධ නිෂ්පාදනයේ මූලික කාරණාවල අය පටන් රස ඖෂධ කොහොමද යොදාගන්නේ, ඒවැදී සිදු කරන්න විශේෂයෙන් සැලකිලිමත් වන පත්‍යාපත්‍ය, ඒ හැම දෙයක් ගැනම විශේෂයෙන් දැනුවත් කිරීමේ වැඩ කටයුතු වැඩසටහනක් ඔබතුමියලට ලබා දෙන්න හැකියාව තියෙනවා. ස්තුතියි.
Thank you, madam. And any other questions from the audience?
Madam, I want to give some inputs. We have learned Rasashastra on our own, not help of anybody. By critical reading of books. Rasaratna Samuchaya, Rasatarangini. You write down take example of Suvarnakalpa. You write down the gunas, you write down the perfect karmas, write down the gunas of Jasad Bhasma, write down the gunas of Vanga Bhasma, see the similarity between Suvarnakalpa and Jasad Bhasma, see the differences between Suvarnakalpa and Jasad Bhasma, try to correlate. You will find that Jasad and Suvarnakalpa acts same. So, to try on go with the text and just write down and try to implement in your clinic. Dare and act. Give in the small doses, 10 milligram, 20 milligram, 30 milligram, and you will get, definitely you will be patient will be benefited, and slowly your daring will increase. There are some safe Rasaushadhis. Says if you are very much frightened to use Samir Panna, don't go for it. Try with the simple Shunga Bhasma, Suvarnakalpa, Jasad Bhasma, Panna Pishti, Moktik Pishti, Pravar. Try it for 6 months or 7 months. Then add in that small dose of Rasasindur. We are scared to use 20 milligram, 30 milligram of Rasasindur. Use 5 milligram 2 milligram. And by the experiencing you are gaining by the clinical practice, you can develop your own experiences. I think there is no need of any course at all.
Thank you, Dr. Mahesh and Professor Sayak, along with Dr. Nirasha. So any questions from the audience? I would like to open the forum. We have a couple of minutes left. And also the resource personnel will be available after the session as well. So if there are any questions, so the value, the outcome of Sambhasha, the symposium, is to share the knowledge and clear all the doubts as per Chronicles of Ayurveda and the ordinary reading of Ayurveda. So if you do have any questions regarding the session or Rasashastra, there will be ample of resource personnel joined today for the 7th edition. And I believe there is another question.
Can we get Vasanta Kusumakara Rasa and Arogya-Vardhana-Vati together? How long can we get? Is there any side effects? And what is the dosage?
In some Rasakalpas, about Arogya-Vardhini or the Sudshekar Ras, in the shlokas itself it is mentioned it should be given for Mandala period. Mandal is a 42 days. So you have to keep gap. You can use for 42 days Sudshekar and Arogya-Vardhini. And if you think about Rasasindur, Samir Pannag and all other these Rasakalpas, usually in my practice I give Samir Pannag, say about 30 to 60 milligram per day for 2 weeks or 3 weeks. Then I keep gap of again for 2 weeks and then again I give Samir Pannag or Rasasindur like medicines. In the case of Suvarnakalpa, say about Vasanta Kusumakar, Suvarna Malini Vasant and all, Rasaraj Ras, Kasturi Bhairava Ras and all, these are all Suvarna, Naga, Vanga preparations, right? So in this case also, you can give these all metal preparations for 3 weeks to 1.5 months continuously, then you have to take break of at least 3 weeks. And again you can give. This is the safest way to practice with Rasakalpas.
Is there any food prohibitions like Kakarashtaka?
Kakarashtaka, yes. Kakarashtaka food that should not be there while using this Rasakalpas.
Okay, thank you, sir.
Asked in one of the conference, we said that Vasant Kusumakar Ras has a cardioprotective effect. Vasant Kusumakar Ras protects the pancreas. Vasant Kusumakar Ras is found to be effective in NFLD. Vasant Kusumakar Ras slows down the progression of diabetic nephropathy. It means it has that renoprotective effect also. So the answer which I had given was, okay, you can take it continuously. You take it continuously, but every 3 months or 6 months. Okay, if required, we can do LFT, RFT. Because I have seen our director, Mr. Ranjit Puranik sir's father, for last 38 years. Every day, sir, he has taken Vasant Kusumakar Ras. So ultimately what sir is telling is right. He said that you, if required, give a washout period or observe his vitals, do his blood test. But because see, it has protective effect on all the organs. It is also effective in encephalopathy. Encephalopathy is nothing but dementia related to uncontrolled diabetes. So there is no harm, but as sir said, okay, we should check the patient regularly, because anyway these medicines are to be meant to be taken for a longer duration of time. I am talking of Vasant Kusumakar Ras, I am not talking of Arogya-Vardhini.
Thank you, sir. And another question, since Western medicine and Ayurveda are two different truths, these are the words that are written here, is trying to validate Ayurveda treatments by using Western theories is 100% effective. What are the opinions? Repeating the question again, Western and Ayurveda medicine are two different truths. So trying to validate the Ayurveda treatments by using the Western theories is 100% effective, and opinions. Sir?
Doing an Ayurvedic clinical study or an experimental study, okay, where is Ayurveda in it? So, see, it's like a double-edged sword. I gave an example of Asti Poshak tablets. If you could observe it in this clinical study, we had used an Ayurvedic score also, Asti Pradoshaj Vikar. One score was developed, and we had used that score because it was based on Sahitas and CCRS guidelines. When we did a study for iron deficiency anemia, we had used Pandurok symptom rating scale score. So whichever validated scales are available, we are already using it. Now, a person who has asked this question, I will ask you, whenever you are managing diabetes, okay, you rely on blood sugar levels and sonography, yes or no? When we are using, see, this Western techniques are to help us in diagnosis and to assess the treatment progression. Okay, because these are beneficial. Whatever is beneficial, we should accept it. And the person is not, that question is not perfectly, it's not wrong, it's right. So we keep in mind that whenever we do a clinical study on Ayurved products, okay, we should definitely use Ayurved scales which are available, or in fact we should develop Ayurved scales. Like for Amla Pitta Mishran suspension study, we assessed it on Amla Pitta symptom rating scale score. And in our second publication, we emphasized, okay, and we tried to prove that this Amla Pitta is nothing but functional dyspepsia. Thank you.
Sir, would you like to answer? All good. Right. Okay, so any other questions from the audience? Yes, one final question. Yes, madam.
I'm Dr. Varuni from the Ayurved Hospital. This is regarding autism to Dr. Suhas. Have you done any experiments regarding autism to give Rasaushadhis, sir?
Basically, the most important diseases that we come across in children, especially in the neurodevelopmental disorders, one is autism and other one is we take the help of ADHD. Especially autism disorders, we have to treat as per the Kapha and Vata type of Unmada, the line of treatment that we follow. And in case of ADHD, we use Vata and Pitta type of Unmada line of treatments are used. We commonly use like Swarna yogas, especially the Swarna Prashana, what is commonly used nowadays as immune boosters is commonly practiced. There is also various types of like Guti-Vati is also used in various types of disorders. But this is not a condition which mainly gets cured by some medicines, because it's like you need a multi-system or a multi-disciplinary approach is required, where you need therapies, you need medicines, you need training, you need occupational therapies, you need speech therapies. So it is like such a training that you need to do both to the child, parents. So just by medicine is not to get cured in such autism cases. You need different types of therapies, and all like only Rasaushadhi may not be the only solution for autism.
Thank you, sir.
Right, thank you very much. So as the time is limited, we'll be winding up the question session.